Good morning, guys. Today our topic is cardiovascular system. Firstly, I tell about heart sound, how heart sound produce. Before telling about how heart sound produce, I tell these all five diagram of heart, which roughly represent the heart four chambers. So before I telling about the heart sound how to produce, I tell about these all the diagrams. And firstly, I tell about the diagram first. In this, I represent the atrial systole. The meaning of atrial systole is the systole means contraction, and in this diagram I represent the contractions occur in more in the atrium. Due to more contraction occur in the atriums, the walls becomes open, and the tricuspid wall and the mitral wall, both of walls are open, and 30% blood fillings in the ventricles. During atrial systole, only 30% of blood filling occur. More and maximum blood filling occur during the time of diastole when the heart is in relaxation phase. After some milliseconds, the situation becomes changed, and the second diagram, which represent in this the tricuspid wall and the mitral wall, both walls are closed, and the sound is produced. That is S1 sound. Why we write M1 first and T1 second? Because M1 means mitral wall close firstly, and after some millisecond, the tricuspid wall close. That's why we write M1 first and T1 second. S1 sound is produced when the end of the atrial systole. Why it is called as isovolumetric contraction? Because in this phase the heart no blood enter and no blood out from the heart. That's why it is called as isovolumetric contraction. In this contraction occurs in the ventricle, but that not too much of contractions, so the pulmonary artery and the aorta both are closed. After that, after some millisecond, the situation become change and ejection click occur. So never say after S1 sound, the S2 sound is produced. After S1 sound, ejection click occur. These all are cardiac events. In ejection click, the aorta and the pulmonary artery both are open. The meaning of ejection means blood out, means blood come out from heart. In this, the bulging of both tricuspid wall and the mitral wall. How the bulging of both walls occur? Due to more contraction occur in the ventricles, and due to more contraction occur in the ventricles, the aorta and the pulmonary artery both are open, and 80 ml blood out from the aorta and 80 ml blood out from the pulmonary artery. And those 80 ml blood is also called as stroke volume. The both wall coordination is most important in this phase, because if no coordination in these walls, and the timing is not proper to close these walls, so the problem occur in the heart. It may cause pulmonary edema, and it may also cause cardiomyopathy. After some millisecond, the situation become change, and the both pulmonary artery and the aorta both are closes, and the tricuspid wall and the mitral wall both are closes, and the free flow of blood from inferior vena cava and the superior vena cava comes in the right side of the heart, and the uh, lungs free flow of blood come from the left side. Why it is called as volumetric relaxation? Because in this phase the blood is only enter, not changes in the walls, all walls are closed. So after some millisecond the situation become change, and the free flow of bloods enter in the ventricle, because in this the tricuspid wall and the mitral wall both are open, and 130 ml of blood filling during the time of ventricle diastole. These 130 ml of blood is also called as end diastolic volume. Why it is called as opening snap? Because in opening snap the mitral wall and the tricuspid wall, both walls are open. These all five diagram I want to tell about. Firstly, atrial systole, and after atrial systole I tell S1 sound means heart first sound is produced. After heart first sound, ejection click occur. Ejections means out, and the blood comes out from the heart, that is through pulmonary artery and the aorta. After that, some millisecond, the situation become changed and the isovolumetric relaxation occur. In relaxation, the heart is in relaxation phase. Both the walls of the heart are closed, and after that, the opening snap occur. In opening snap, both the wall, tricuspid wall and the mitral wall, both walls are open. How S2 sound produced? When the closure of pulmonary artery and the aorta, the sound S2 is produced. So guys, these all 5 diagram I make for understanding purpose, but now I want to tell about the short summary of these 5 diagram, how to remember easily these all 5 diagram. Firstly, I tell about two heart sound, that is lub and the dub. The S1 sound is also called as lub sound. It is produced when the mitral wall and the tricuspid wall both are closer. Then the sound produced is called as S1 sound. After S1 sound, the ejection click occur. In ejection click, as we all know, the pulmonary artery and the aorta both are open, and the 80 ml blood out from the aorta and the 80 ml blood out from the pulmonary artery. Then after ejection click, the some millisecond after, the S2 sound is produced, that is called as dub sound. And how it is produced? When the aorta and the pulmonary artery both are closer, then the sound is produced is called as S2 sound. And after S2 sound, the opening snap occur. In opening snap, it signifies the tricuspid wall and the mitral wall both are open, and after opening snap, S3 sound is heard in some adult whose age group is up to 35 year, and in some patient S4 sound we can hear. I explain it later. And it is the sequence of the heart sound. Firstly is S1, and then ejection click, then S2 sound, and after S2 sound, opening snap occur, and after opening snap, S3 sound, and before S4 sound is S3 sound, and after S3 sound, that is S4 sound, and before S1 sound is S4 sound. These all are the sequence of the heart sound. The period between S1 and S2 is called systole, means contraction. While the duration between the S1 and S2 is called systole, and the duration between S2 and S1 is diastole. The S2 and S1 duration is more than the systole because relaxation time is more and the contraction time is less. If we take a case, normally the heartbeat is 70 beats per minute in 60 seconds, so the cardiac cycle time is 0.8 second. Systole means 0.3 second, the heart contraction, and diastole means 0.5 second, the heart is relaxation. And in during the time of systole, the 80 ml blood comes out from the heart, and during the phases of diastole, and diastolic volume, that is 130 ml, is fill in the ventricles. In case of arrhythmia, pulse rate is 300 beats per minute in 60 seconds. The cardiac cycle is 0.2 seconds because in this the heart work more and more rapidly and rapidly. Systole means 0.1 second systole in this case, and diastole means 0.1 second diastole. The relaxation time is reduced and the end diastolic volume also decrease. After that, I tell about S3 and S4 sound is heard with the help of a bell. part of stethoscope, that is low pitch sound, and S1 and S2 sound is heard with the help of diaphragm, which is high pitch sound. It can easily remember through the high pitch sound is listened with the help of big part, that is diaphragm, and low pitch sound is heard with the help of bell, which is short as compared to diaphragm.